This was a real-world study that looked at the three DOACs, three most popular DOACs, apixaban, rivaroxaban, and dabigatran that have been on the market for the last several years compared to Warfarin, and looking at how they fared in the real world. We obviously have had clinical trial data, and clinical trial data is randomized, prospective, controlled data. So we know how those data fared for all three of these agents. But what we didn't have is large real-world data. So our study attempted to get a sense of how these DOACs fared in the real world compared to warfarin. So as you already know, patients with non-valvular atrial fibrillation have about a 5-fold increased risk of developing stroke. Stroke is bad. We know that to reduce the risk of stroke over the past 2 decades, we've learned that anticoagulation significantly reduces the risk of stroke. But in balance with that is the risk of bleeding. And what we found, the results that we found on these 186,000 patients was that when compared to warfarin, we found that on the efficacy side, that all three agents actually reduced the risk of stroke, but 2 of the 3 agents were statistically significant. Apixaban had a hazard ratio of about 0.4. And it was highly statistically significant. Rivaroxaban had a hazard ratio of about 0.7, and it was also statistically significant. And dabigatran had a hazard ratio of about 0.94, and it was not statistically significant. So 2 out of 3 were statistically significant. Then obviously the next step was to look at the impact on bleeding, and the impact on bleeding showed that 2 out of 3 agents showed also appropriate trends in terms of bleeding, and one of them actually showed got worse in terms of major bleeding compared to warfarin. Apixaban had significantly decreased the risk of bleeding. Dabigatran, the trend was in the right direction. And rivaroxaban was statistically significant, increased risk of major bleeding. So the bottom line of all of this was that the one drug that seemed to have statistical significance in terms of reduction of stroke and reduction of major bleeding compared to warfarin was apixaban. Dabigatran had a reduction of stroke that was not statistically significant but had reduction of bleeding, and rivaroxaban had reduction of stroke that was statistically significant but also statistically significant worse than major bleeding in our study, in this large Medicare population study.